Now, Prime Minister Boris Johnson has pleaded for us all to have cautious New Year's Eve celebrations tomorrow, encouraging us to get tested before we leave the house. But this plea is undermined by a shortage of lateral flow and PCR tests across the country.
The Health Secretary, Sajid Javid, has blamed the shortage on an unprecedented increase in demand during the festive season. But the Tory MP, Sir Roger Gale, said he'd been told by Javid that there was a global test shortage and the UK was buying all they could.
Joining us now, Dr. Leyla Hannbeck, who's Chief Executive of the Association of Independent Multiple Pharmacies. A very good morning to you, Dr. Leyla.
Good morning.
So how big a struggle is this at the moment?
Oh, it's a big struggle. It's very frustrating because the demand is obviously very, very high because of the government guidelines in terms of like the self-isolation and what you need to do, needing lateral flow tests. And people have been asked to go to their pharmacies to pick lateral flow tests up. But unfortunately, the supply is so patchy and inconsistent that when people come to pharmacies, we don't have the stock to give to them and we have to turn them away, which causes a lot of frustration and anxiety for people. And we've seen the number of abusive behaviours going really, really up in community pharmacy.
That's interesting. So it's the abusive behaviour that's of more concern than perhaps people who are coming in who may indeed be positive, asking your colleagues for tests but not being able to identify that's worrying you.
Yes, everything worries us, to be honest. You can imagine we are in a situation where people are coming in expecting to get a lateral flow test. And when they're turned away and said, unfortunately, we don't know when it's going to come because we get no communication from the government when we are going to be getting the stock and how much we're going to be getting. So people obviously, they want to do the right thing, particularly now when the New Year's Eve is just around the corner and people want to be with family and friends. And they want to do the right thing to test themselves, but they don't get access to that. So it's a very frustrating situation for us, but also for patients who come in.
You say frustrating. I mean, it's madness, isn't it? You've got a government telling everyone to get tested. It's the only way we can keep on top of this. You can't get the test for love nor money. I mean, you say frustrated. You must get angry at sometimes.
Oh, angry, sad, crying, all emotions going because of the fact that we are helpless here. We are put in the middle of everything, and people coming in expecting that we want to help them. We understand the situation, but there's nothing we can do about it. We've been banging on about this since weeks now in terms of like the supply issues, because we were seeing the demand going up all the time. And yet we still don't know what's going to happen in the days to come when we are going to get the supply that we need.
Leyla, the government's saying that they have double the supply that they had before the 18th of December, around 900,000 tests per day. But that simply just hasn't been meeting the demand. Is that because there are, lots of people are trying to protect their loved ones, it's Christmas, it's New Year? Or are there a few individuals, do you think, who are stockpiling in sort of Brexit toilet roll kind of way?
We are asked to give no more than 2 boxes to people who come in to collect, and they've got a code. So the supply is limited anyway. But the thing that is very frustrating is that despite the fact that we've been told that there is stock, and pharmacists are going to get them, it's very sporadic. So we're basically getting a carton of tests, and it goes within really an hour or two. And then there's nothing left anymore, and then days pass and nothing else comes in. So that is really difficult to keep on top of and let people know when to come back to the pharmacy so that they can get their test. And the New Year is approaching, and people want to get tested, and we still don't have the tests. And the government is telling people, test yourself.
Yeah, sorry, Doctor. What about other pharmacies? Are you all fighting each other to get access to whatever tests there are, or is there a sense of we're all in this together, and do you help each other out?
We are absolutely all of us in it together across the whole country, and we all affected, all of us, by the same issues. So what we want to happen is the government to sort this out as soon as possible. If there are guidelines in place asking people to do something, in relation to self-isolation and all of that, then the supply and the plans will need to go with it to make sure that we meet the demand. It's not there at the moment.